All right, this is going to be another quick one. Part 2 of do's and don'ts. So you'll see that under this right chart panel, we have a lot of templates that we've set up, and we make these available for y'all to use. We'll talk more about that at a later date, but typically you're going to want to use the templates for the physician that you work with or create your own templates. But for today's purposes, for do's and don'ts, I just want to point out something that I frequently see with PGY1 interns. It's a big no-no. And so you go over here to merge the template, and a lot of times I'll use one like this, General Review of Systems Physical Exam. Okay, if you click on that, that's fine. It'll merge in the entire review of systems and the entire examination. Okay, and that's basically a negative review of systems and a negative general examination. So I've created this template for effectively to be the review systems and physical exam for a healthy individual, someone who comes in for an annual physical, doesn't have any medical issues, their review systems is completely negative, their physical exam is completely normal. So we clicked that and merged it in. The issue that I frequently see with interns is they forget to go back and make some changes and edits. So when I'm going back to review the intern's notes at the end, I go, okay, everything looks good with the assessment, the treatment, correct medications. Then I go back and look at their exam later in their review of systems. I go, everything's normal. They clicked the negative. They didn't make any adjustments. Well, when you go up here under the patient medical history, as we start looking down to surgical history, we'll see this patient has a left below knee amputation due to complications of diabetes. In the overview of the patient's problem list, we see here the patient's status post below knee amputation of left lower extremity. So they merged the review of systems in, but they didn't go back here and make any edits. Musculoskeletal says they don't have any pain, muscle aches, muscle weakness. Under the problem list, it says they have arthritis. So I would go back into this section of the review of systems, and I may just clear it all out. That's one option would be to clear that category out and just take it out completely. But usually what I'll do is I'll just make a comment. I'll actually go down to the musculoskeletal. I'll clear out the category. And then I'll say positive for arthritis, history of left leg amputation. Okay. So now we've just commented on it. It doesn't look like we've just merged in a review of systems and paid no attention to what was in the review of systems. Again, this patient has gastroesophageal reflux disease, and they're on pantoprazole. I'd actually go down here to gastroenterology section. I would remove where it says they don't have reflux. I would take that off and at least put taking pantoprazole, so we know that that's part of the review of systems. So as you're going through the review of systems and you're asking patients questions, sometimes they forget that it's in my medical history right here that it's in my medical history that I have acid reflux and I take pantoprazole for that. Same thing under psychology. It says they don't have any depression or anxiety, but we see over here on the patient's problem list, they have a code for depression and anxiety. We also see on the medication list that they're on Zoloft. We can see on the med list they're on Zoloft, which is sertraline. So again, I would go back under the review of systems and just put under the psychology section, taking Zoloft. Now that shows under depression. Same thing with anxiety, taking Zoloft. See, now you can go through this review of systems and it shows, okay, this person's kind of paid attention to details and they looked at the problem list and the med list and make sure their review of systems is correlating with what they stated under the problem list and the med list. Same thing goes for the examination component. This patient, again, we've said has status post below knee amputation of left lower extremity, but musculoskeletal exam says normal range of motion and strength, no laxity or instability. Again, we've merged in a ROS and physical exam for a healthy patient here for a physical with no problems. You need to go back under the general exam and at least comment on it. You can click into this section and you can clear it out if you want. Click clear if you want, and I'll get rid of it. You can say wearing prosthetic for left below knee amputation. You can put something like ambulates with assistance of walker. Okay, I cannot tell you how many times I've seen first years send over a chart note in the musculoskeletal. It says normal range of motion and strength, no laxity or instability. And when I get into the room, the patient is literally in a wheelchair. Already it shows that the resident hasn't paid attention to details, right? So patients in a wheelchair, obviously, they're not going to have a perfectly normal musculoskeletal exam. So just make a comment. Hey, the patient is ambulatory with a walker. Patient ambulates with a cane. Patient is in a wheelchair secondary to history of arthritis. Again, you want your note to be clean. You want your note to match up with the problem list, the med list. Everything should relate to each other within the note. Thanks for watching.